Greetings, friends, Romans, countrymen, therapists, people with OCD, people without OCD, people who wonder if they have OCD, but maybe it's not OCD, but what if it is OCD, but what if it isn't OCD? If it isn't OCD, what does that say about me as a person? Because then if it isn't OCD and I am that thing, that would be awful and horrible. So I'm afraid to go find out if it actually is OCD or not, because then what if somebody confirms that it is OCD, and that could be good, but then maybe not so good, because then I have to live with OCD for the rest of my life. But it could be horrible, because if I find out that I don't have OCD, then what if I actually am these things, and blah, 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 not, not. Sounding familiar to anyone so far? I'm going to bet yes. Tonight's webinar, as always, brought to you by NoCD. NoCD is a downloadable app. You can get it on iOS or Google Play. Please feel free to go there, download the app. There's an amazing community of individuals with OCD across the world who are a part of the OCD community. And we'd love to have you on that community. Meet other people like you. We also have teletherapy available as well, too. We're moving across to more and more states all the time, and taking more and more insurances all the time as well. So come join us on the NoCD side. We'd love to have you. I believe there's a link below me. I don't see it, but Kaylee tells me it's there. Kaylee is behind the scenes. Hey, everyone wave to Kaylee. All right, see, Kaylee's our behind the scenes friend there. Check out the link. Do a free 15-minute call with our care team, and we'll see what we can do for you. Carl says, Dr. McGrath, I saw you in Hoarding Buried Alive. Didn't realize I was a TV star. Yes, Carl, I am. I'm famous, Carl. I don't know if you knew that or not, but not only do I do these webinars, I was on 3 episodes of Hoarding Buried Alive as the therapist, not as the person with hoarding, by the way. Just wanted to throw that out there in case any of you were curious. And I also did a show for Discovery Health Channel called Panic. So if they did a second season of Obsessed, I was in the running to be the host of that too. So that was kind of fun, but it did not materialize, unfortunately. So anyway, hope you're all doing well. It's been an interesting day here. That's my crown. Fell out of my mouth about an hour ago, so I've just been kind of futzing with it. So, you know, that's a good time. Looks like a trip to the old dentist coming up in my life. And for those of you who are watching this on the replay on our YouTube channel, welcome. Please come join us live Wednesday nights at the 7 p.m. Central Time Zone. Zone A, maybe even. Jenny says, hello, I've asked this a few times, but don't get it answered. And then there's nothing else. Well, Jenny, maybe that's why it doesn't get answered. There is no question. Let's see if Jenny comes back to us with a question. OCD Crusher is here. I always loved that name. Molly Louise, welcome. Good to see you. Tim Asher, will this be more entertaining than the presidential debate? Well, Tim, that is a great question. Probably won't stutter as much, and I don't say that in the sense that I mean stuttering in terms of President Biden having an actual stuttering problem. I mean it more of in terms of the two of them just not able to get a word out because they were at each other so very much, right? And that was the problem. Nobody could get a word out. So it just felt like it was stuttering. Now let's talk about stuttering for a minute, because I want to talk about stuttering. Stuttering is a fascinating thing, especially in the sense of people who have a clinical diagnosis in the stuttering area. And I want to talk about a famous, well, not famous to me, because I think they're amazingly interesting, patient that I worked with who came from another country who had a stuttering problem, but didn't know that he had a stuttering problem until he came to the United States. Because in the country that he was from, everyone just sat there and would let him take his time to get his words out. But when he came to the United States and was going to be a teaching assistant, guess what happened? Everybody was complaining, oh my gosh, get this guy out of here. This is awful. This is horrible. We can't have him as a teacher. He doesn't know how to speak and all these kinds of things. And it wasn't until he was in his 20s as a teaching assistant that he said that he knew that he stuttered. He had no idea before that he actually did it. Now, isn't that fascinating? This kind of talks to some of our cultural things. So let's not be mean to each other, as we saw last night. There was some name calling last night. There was interrupting. There was everybody trying to get words in and nobody getting words out is kind of what it felt like. That's what I meant by stuttering. Nothing about the fact that President Biden is a stutterer. But more on the lines of, yes, let's be cordial. Let's be nice. I find it interesting. People without OCD, as we saw maybe on TV last night, can be amazingly mean to each other. And people with OCD, are hugely afraid of what if I do have OCD? All right. And what if I were to be mean with somebody? And what if I were to say something awful or horrible? Or what if I were to call somebody a name or something like that? So interesting. As our friend Carl Cornett said a couple of weeks ago, and I always like when Carl says this, we're either a gathering of some of the most awful or horrible or dangerous people in the world, or we're just a gathering of people who have obsessive compulsive disorder. Jenny, your question has appeared. Sorry, I stopped typing, but got erased. I was asking about, I have intrusive thoughts constantly about bad things happening and feel the need to tell God I don't want it to happen each time. Well, here's a funny thing about that, Jenny. Most people who have a belief in a God believe that that God is all powerful and almighty and all knowing, and therefore that God knows things already. So I've always found it humorous that when OCD says, well, I need to tell God why I did or didn't do this thing or what the meaning of that thought was or something, then that actually means you don't think God knows everything, because why would you ever have to tell an all-knowing God something? Wouldn't they already know it? Now there's something to think about, right? I mean, it is kind of interesting if you look at it that way. Tim says, yes, thanks. The debate sounded a lot like my OCD, constantly interrupting. Yeah, it is, isn't it? Cindy says, this is my first time here. I'm not sure what this is about. Well, Cindy, this is about OCD. That's exactly what it's about. We talk about obsessive compulsive disorder. People can ask questions about OCD. I try to get to as many of them as I possibly can. And we just have a fun time chatting away. And then there's a few people on there like Mr. Carl himself and OCD Crusher, who also like to kind of assist with some answers to things for people as well, too. So thank you all. Anybody interested in kind of doing some more work, maybe advocate-wise with OCD, let us know. We'll see what we can do to kind of get you on board, help you out and everything. So, all right. So let's fly around. Richard says, hi, Dr. McGrath. Hello, Richard. I have disgust-based contamination fears that don't easily habituate. I do ERP and my anxiety eventually goes down, but my disgust does not. Seen this? Yes, Richard. So in the model of habituation for anxiety disorder treatment, which ERP was based on for many, many decades, we saw the idea being that only when your anxiety went down did that truly mean that you were actually getting help. Now, that was very high pitched, by the way. I don't know why that came out that way. Now, but anyway, we may also look at this through an inhibitory learning model. And what do we mean by that? The idea in inhibitory learning is that I learn a new way to respond to the thing that I was responding to before in a way that I didn't really like responding to. So if my old way to respond to a disgust-based thing was to do a ritual, my new way might be to just leave it there and not do something about it. Now, that could still make me very anxious, right? I could still be very anxious about that. But inhibitory modeling says that's okay. As long as you learned a new way to respond to it, that's plenty good right there. So, Richard, I would not always say that anxiety decreasing is the one and only way for you to be okay. I would say that, you might just have a change in belief. You might learn that you can handle it. And you might recognize that that's okay. Now, it says here, your anxiety eventually goes down, but your disgust does not. So maybe you'll always feel disgusted by a certain thing, and that's okay, right? It could just be that something always disgusts disgust you. You know, maybe people with a phobia of needles might always hate needles for the rest of their life, even though now they'll get a shot, but they still hate it. Ugh, right? So it could just be that way. It could be the way it goes. So maybe you'll have disgust. That's all right. As long as you know you can handle it. What's the topic for today is a question. It's kind of a free-for-all today, everyone. We just throw things out. Molly Louise says, so glad you found no CD. I've had it since I was about your age, and I'm 23 now. This has been so helpful. You're not alone. Oh, Alexandra says that to Molly Louise. Sorry. My apologies, Alexandra. Thank you, Alexandra. Could I give, Mason says, could I give some ERP tips on how to tackle a fear of becoming convinced that my obsessions are true? Almost like I am afraid that they will become a delusion. Thank you. You're the bomb. Thank you, Mason. Well, Mason, I'm going to ask you something first. How many of your obsessions have actually come true? Just think about that first, right? How many of them have actually come true? Any whatsoever of the things you've been obsessing about for years? Have they come true? The likelihood is not too many. Okay. In the sheer number of obsessions versus the number of times something's come true, probably less than 0.5%. Well, to be generous, we'll say less than 0.5%. All right. So now your fear is, what if they become a delusion? But let's take a look at this question more closely. A fear of becoming convinced my obsessions are true. So I don't think they're true. I'm afraid of becoming convinced that they're true, is how I read your statement right off the bat. So this is, again, great OCD play right here, everybody. I mean, this is Mason, thank you for this. This is something right out of OCD's playbook, which is, you know what? I don't believe these are true. But what if one day I do? Now, I should prepare for that just in case one day I do actually believe these things are true and I become delusional. I call this Southern therapy. I'm not getting ready. I'm fixing to get ready to do something. And that's what you're doing right here, Mason. You're fixing to get ready to do something. And what I would just like you to do is, you don't have to be fixing to get ready to do anything. I can't guarantee that you will or won't be convinced of something being true. I can't. Okay. Just doesn't work that way. What I can help you do, Mason, is to recognize that you probably waste a great deal of time worrying about something becoming true. And the deal would be this: if something actually does come true, you probably have the ability to handle it. You just don't give yourself credit for it. So maybe you'd spend a lot more time in your life being productive by not worrying about what if something were to come true, but by allowing yourself to recognize that you have the ability to handle things if they were. Now, boy, doesn't that sound nice? How do you put that into practice, right? What and there's your beginning question. What are some ERP tips for this? So one of them might be, well, I hope 4 things that I'm afraid of come true today, and then see if they actually do. Start your day off that way. You know, I could start my day off tomorrow with, well, I hope I run 3 people over with my car, molest the dog, set my neighbor's house on fire. I seem to like to pull that one out every week. I don't know why. And let's pick. Oh, and then become contaminated with COVID. I hope all those things happen tomorrow. Now, anybody who's watched any of my webinars up until now has seen me do all these types of things all the time. Not one of them has come true so far, but I could become convinced that one of them might come true, not knowing which one. So would it be best for me to prepare for all of them, or can I just sit with the notion that one of them may come true, and whichever one it is, I'll figure out what to do about it when it does come true? So Mason, I hope that helps a little bit, gives you some ideas of some things to go on. All right, let's see. I'm struggling because of a lack of unconditional positive regard and trust-filled relationships. How can I trust a therapist who emulates those fears? It's their job to care about you, especially because no matter how I tried to not to, I got emotionally attached to my last therapist. One thing that I kind of like about certain models of therapy and something that we do here is uh, I think a really good therapist is trying to work themselves out of a job as quickly as they possibly can. Okay. That would be something that is really, really important for a very good therapist to do. Now, when we say that, we might take a look at some of the modeling that we have going on through NoCD of, I would like to get you out of our really big kind of therapy protocol, but you've got me in your back pocket if you need me at times of struggle, right? And that's how I'd like to see my role as a therapist for everyone. I don't really want us to meet every single week for the rest of your life. I'd like to do good therapy, have you learn the skills that you need to learn to challenge the anxiety and the OCD and do what you need to do, but then have access to me at times that you're struggling and be able to contact me and me be able to do some stuff for you to help you out in the moment, and then go back in the back pocket ready for you when you need me again, which hopefully won't be all that often because you've really learned the skills that we're trying to teach you. So I hope that makes sense. OCD and ADHD, where do I find a therapist that works with both? From Suffering Sucks. Great name, by the way. Well, I would say you could reach out to NoCD. Some of our therapists have some specialty in ADHD. It kind of depends on the state that you're in and everything, but that's something you could at least try to do. If we can't do it, we can work on seeing what I can do to try to help you. There are a couple of places that you can go to find therapists, and let's see what we could do at NoCD first. And if that doesn't work for you, then reach out to us, and I'll see what I can do if I've got anyone in my circle of buddies and friends who might be able to assist you with that. Okay. Is it possible to have full recovery where OCD no longer impacts your life? I never talked about this idea that OCD no longer impacts your life. I mean, from what I have seen working with people, once you have OCD, you have OCD. It's not that it doesn't impact your life. There will probably always be some level, but that impact might be like 1% of your life or maybe 0.5% of your life. It doesn't have to be a massive part of your life. So that's what I think is exciting about it. I mean, just like if you have diabetes, the likelihood is it's going to impact some part of your life. If you have a heart condition, it's going to impact some part of your life. So it's interesting when we go to physical, almost never do doctors ask, will I ever get to a point that I'll have no impact from this whatsoever? Once they're told no, they're like, okay, well, then I'll just have to figure it out. But in mental health, we think, but I should be able to get there. Like as if there should be a way to put my brain back together in exactly the right way that will never have this problem. Well, I don't think that it works that way. I have not seen it work that way. So what I think that you really want to be able to do is to learn how do you manage something. So some of you have heard the example on here before, but I have tinnitus, which is a constant ringing in the ears. And I gave the example last week of I just hummed for about as long as I possibly could with a very high pitch. I hear that sound 24/7. Now, tinnitus will always impact me. I will always hear it. In fact, it's very loud now because I'm talking about it. So it's never going to go away. Well, at least as far as I can tell, nobody's come up with a cure for it as of yet. So, and I'm not holding my breath for anybody to do so. So what do I have to do? I have to learn how to live with it. And that is what I have done. I have learned how to live with it. I'm struggling with HOCD, but remember, everyone, we're going to call that orientation-based OCD now because it's not just a fear of being gay. Because if you're gay, you could be afraid of becoming straight. So you have a orientation-based OCD. You don't feel like ERP will help anymore. It feels too real. Well, I get this kind of statement a lot as well too. So, last week we were writing themes on the board. Maybe that would be a theme for this week. It feels too real. And remember, everyone, in fact, I'm going to go put that on the board. Everyone, moment, please. Somebody hum some Jeopardy music or something like that. If it didn't feel too real, it wouldn't be OCD. No one with OCD has ever said to me, well, it just kind of feels a little bit bad. It's kind of a little annoying sometimes once in a while. No, it's always bad, awful, horrible, catastrophic, worst case scenario shit. Excuse me. Sorry. Worst case scenario stuff ever in the world, right? That's the way that OCD really works, is jumping onto that worst case scenario kind of thing. So here's what I want people to think about. It is always going to feel excruciating when you're working on this. But that's the sign of really good therapy, that it feels so difficult, because it means you're actually facing the things you're afraid of. If you're doing therapy and it's not bothering you, it's not good therapy for OCD. In fact, it might be making the OCD worse, actually, instead of helping you. OCD therapy ought to be uncomfortable. It's just the way that it is. Now, you know who does OCD therapy? Shocker, everyone. NoCD, through their teletherapy, does OCD therapy. So check us out at treatmyocd.com and download our app on the Google Play or iOS and see if one of our teletherapists across the country might be able to assist you with your obsessive compulsive disorder. How do we deal with existential dread, anxiety, OCD? Well, part of the reason is to work on accepting that we'll always have doubt and never have the answers to everything. Right? We can never know everything. I've had some interesting conversations with patients in the last few days about people who wanted 100% assurance that somebody was thinking certain things this certain way, or that they had certain feelings that were 100% whatever it was. And boy, I don't even have 100% assurance about the things I think or feel. Isn't it interesting that someone without OCD doesn't care about having 100%, but somebody with OCD mandates that that be the case? I just don't care if I have 100%. I really don't. I'm okay with it. I'm okay with not knowing everything. But you might not be, because you have OCD and it tells you that that's fine for most things. But for this one thing, you have to have 100%. Absolutely have to have it. All right. I think we're caught up on some things there. What? I'm going to assume, Melody, you meant what causes OCD, but your question says, what causes old? Why do people have it? Well, people get old, Melody, because they grow. But otherwise, I'm going to go with what causes OCD. We don't fully know. We know that there's a mix of genetics and environmental stressors that come to play with each other, and the right things match up at the right times to cause certain things. So 5%, up to about 2.5 population. So 140 people will have OCD at some point in time in their life is kind of what we know. And it probably plays a role in some overactive aspects of the fight, flight, or freeze response, and some maybe highly imaginative or superstitious type of thinking could play some roles and things. There's lots of different things. They're doing a ton of genetic studies right now to try to figure it out. So, Melody, I think we're probably a good 50 to 100 years from knowing exactly why people have it, and what, if there's ever going to be like a brain kind of thing that they could do about it. But we're just not there yet. And I don't know if we'll ever fully get there, but there may be some more interesting things coming down the pike in a few decades on that. Saltmaster, hey Doc, quick question for you. How'd you get so cool? Saltmaster so far is winning tonight, everyone. Just want to say that. If anyone wants to beat that, throw out some other great compliments to the old Doc here, and then you'll be the winner. But Saltmaster winning tonight. I will say this, Saltmaster. I got into this and really enjoy having gotten into this based on a postdoctoral fellowship that I did at the St. Louis Behavioral Medicine Institute under the direction of Dr. Alec Pollard, who was a guest on here one time. So thank you, Dr. Pollard, for being here with us. And I was in that clinic for about a week, and I just thought, I think I'm going to do this the rest of my life. I'm really, really kind of enjoying this. And so here we are. And that's where you get the old Dr. McGrath here with all of you. So, Hadassah, how do you explain harm OCD to people without them thinking you're insane or a danger to society? Thank you. Good question. So first of all, let me ask all of you a couple of things. Who are you explaining it to? And is it necessary to explain it to everybody you know? Are you explaining it to people as a form of compulsion? Like, hey, just so you know, I have thoughts about hurting you once in a while. I just want you to know about it because I feel I'd be a bad person for not telling you if I had these thoughts about you. And now you can decide if you'd ever want to be around me. And I'd be totally okay if you don't ever want to be around me, because I don't know if I'd want to be around me having had these thoughts about me, or blah, 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 right? So first of all, what's the purpose of telling people? Number two, who are you telling? Are you telling other people with OCD? They'll get it. If you're telling family members, which family members? Are they on a need-to-know basis for right now? Is telling people in the midst of therapy always the best thing? Or is it after you've learned to live the experience of having OCD for a while before you become open about it? And there's therapists out there who've written books about their OCD who've become very open about it, but it took them time to be able to get to that spot. So I just want you to kind of think about what the purpose of telling somebody is. Now, more than anything, if you are going to tell somebody about harm OCD, maybe you do it alongside with some bibliotherapy or something, like a great book I know called The OCD Answer Book, which has lots of Q&A about anxiety. I might have wrote it. And yet there's also Monica Williams and Chad Wetternick did a whole book on harm OCD that just came out recently as well, too, some friends of mine. So what you might do is you might have books like that available, and you might say, just want you to realize, I'm figuring if somebody wrote a whole book about this, I'm not the only person in the world who has this. And maybe that proves that I'm not kind of insane or a danger to society. Maybe this is truly an actual diagnosis, and here's what I have, and we can look through this together, and it will kind of explain things. And I can share exactly how my story is in relation to what it says in the books as well, too. So I hope that helps. Erica, I saw something about a connection between OCD and getting strep. Is that true? PANDAS, pediatric autoimmune neuropsychological disorder associated with streptococcal infection, now also known as PANS, pediatric autoimmune neurological syndromes. PANS can come from strep, it can come from Lyme disease, and it might be a few other things as well, too. PANS can lead to the development of obsessive compulsive disorder and or Tourette's disorder in children. If you ever went to bed feeling fine and woke up with OCD or Tourette's the next day, you probably have PANS. And what is it? It is a crossover of the blood-brain barrier by certain antibodies to certain types of infections. When those antibodies cross into the brain, which they should not, the barrier should prevent them, but sometimes it does not. Those antibodies attack parts of the brain that are associated with the OCD circuitry or the Tourette's circuitry in the brain. And that attack can be traumatic enough to cause OCD and Tourette-like symptoms that occur. Treatment would then involve getting a high-dose influx of antibiotics along with exposure and response prevention therapy. Hope that helped. Am I answering questions from the YouTube chat or elsewhere? Nope, right here, Gib Gob. I just answered your question to prove that. Are there programs available that simulate real-life hit-and-run scenarios for hit-and-run OCD? Well, I've gone out driving with patients. When I was running a program back at Amita Health, Alexian Brothers Behavioral Health Hospital for their anxiety and OCD program, which is virtual right now if anyone needs a PHP or an IOP. And I would actually go in the car with people, and we would we would see people riding bikes and we would think about running them over while we were out riding in the car together. So we would actually just go and simulate those very things ourselves, or maybe drive by a school when the children were getting out, or if you know that there's a neighbor who's got a couple of kids and they always play outside at 3:00, make sure when you're going to the store every day, it's at 3:00 while the children are in the yard, and think about running those children over every time you pass by them. So those kinds of things might be very helpful. There are maybe video games where there are people in the road and you could practice kind of not hitting them and recognizing how you can drive around people that are in the road on some of the video games as well too. Susan says, this is so damn embarrassing, doctor. You were in a bookstore recently and a fly came in and was hovering around you. You yelled at the top of the lungs to the fly, "Get the hell away from me." Yeah, well, that would be phobia response right there, right? It could be a fear of contamination from the fly. It could just be an insect kind of phobia as well too. But yeah, it can lead you to embarrassing things. Susan, I know a person, one up you on your story, who was driving and a fly flew in her car and she literally crashed her car into a tree because she just freaked out so much. She just started turning the wheel, slammed on the gas and ran her car into a tree. So yeah, we eventually did some therapy on her and she held the bug. She did very well with it, by the way. It was very, very good. Like a big old cicada right in her hand. So that was cool as well. Kaylee, when doing ERP, I don't really experience anxiety, but rather get emotional and feel guilt. Is that normal response or do I have to get anxious for it to work? Oh no, that's a totally fine response. You don't have to have anxiety whatsoever. You can absolutely feel guilt. You can absolutely get emotional. That's totally fine. It does not have to just be anxiety. And in fact, one of the things that happened is OCD was taken out of the anxiety disorders in the last Diagnostic and Statistical Manual, DSM-5. So it actually isn't considered an anxiety disorder anymore, which is just kind of more further proof for all of you that it does not have to generate anxiety for it to be obsessive. Now, if any of you don't know, let's go to the book. There it is. This is the Diagnostic and Statistical Manual of Mental Disorders. This is the book that we use to diagnose people. Let's go right to the old OCD diagnosis just for fun for everybody, and we'll kind of walk you all through specifically what does the DSM say about OCD. And you'd think at this point I would have, actually maybe memorized the page number that this is on. If I was a good treater of OCD, maybe that would have happened. So, but whatever. There we go. Getting closer. Okay. Not that I don't know this, but I like to read it to everybody. The presence of obsessions, compulsions, or both, which is weird right off the bat because never once have I met anyone who had one or the other. So I just want to start that off right there in 21 years. What is an obsession? Number one, recurrent and persistent thoughts, urges, or images. So remember, it's always those three that are experienced at some time during the disturbance as intrusive and unwanted, and that in most individuals causes marked anxiety or distress. Okay, so guilt can be distressing, emotion, all those kinds of things. Notice it does, and it even says most, doesn't have to be at all. Number two, the individual attempts to ignore or suppress such thoughts, urges, or images, or to neutralize them with some other thought or action. Now, this right here shows you the criticism of Perot, because Perot is not just obsessions. Because if it was just obsession, you have to meet criteria for number two. And what is the criteria for number two? The individual attempts to ignore or suppress thoughts, urges, or images, or to neutralize them with some other thought or action. Repetitive behaviors, compulsions, or mental acts that are driven to perform in response to an obsession or according to rules that must be applied rigidly. So a compulsion is a repetitive behavior, like let's say hand washing, right? Or a mental act, like praying, that somebody feels driven to perform in response to an obsession or according to rules that must be applied rigidly. And number 2, the behaviors or mental acts are aimed at preventing or reducing anxiety or distress, or preventing some dreaded event or situation. However, these behaviors or mental acts are not connected in a realistic way with what they are designed to neutralize or prevent, or they are clearly excessive. So if I close the car door the wrong way tonight, and I think it's the wrong way because I got a phone call when I did that said somebody I know was in an accident, tomorrow I'll have to close it the right way, because if I don't close it the right way, I might get another phone call that there's been an accident, which of course would mean it was because I closed the door the wrong way. Okay, so we may see something like that. So hopefully that gives you just kind of a nice understanding of exactly what we're talking about here in the OCD realm, that you've got obsessions and compulsions that we're dealing with, right? And you don't have to always just feel anxious. You might feel very emotional. You might feel guilty. You might be distressed. Okay? Hope that helps. All right. Let's see. Any insight on when OCD therapy might be available in Nevada? Mason, by the end of the year. We will definitely be there, just so you know. Amy asks about complex PTSD co-occurring with OCD. Allowing yourself to have the anxiety could be traumatizing, and want to know what you suggest. So Amy, good question. And what I always like to do is, first of all, take a look at what is the purpose of the OCD. Is the purpose of the OCD doing things in a certain way to prevent some kind of trauma from happening? Then what I might want to do first is work a little bit on that trauma to make sure that I can handle the trauma before I start getting rid of all the coping strategies that the OCD might have become. So I think it's important, Amy, that you get a really good diagnostic. You see kind of where all the pieces fit together, and you make a good clinical decision on which is the direction you're going to go, and what are the pieces that we're going to work on first, and how are we going to get to that spot that ultimately you want to get to. Okay. But it's a great question. We know that OCD and PTSD go together. In fact, there's some studies out of the military recently showed that many people who are diagnosed with post-traumatic stress disorder in the military are also experiencing OCD. So we know that they kind of can come together. Okay. Oh, so many questions just came in here. Oh, let's go. Why do OCD themes change? I went from cheating OCD and hurting my husband to relationship OCD, which would be similar to that one, but also to having orientation-based OCD. All seem to revolve around my perfect relationship with my husband. Well, of course, we all know, Heather, you don't have a perfect relationship with your husband, nor does he have one with you. That being said, we may, if we have OCD, tell ourselves that we must have a perfect relationship with our spouse. And only by having the perfect relationship with our spouse will everything be fine and great and okay. So, what would be things, Miss Heather, that could interfere with my perfect relationship? Well, maybe it's that I think about cheating on my husband. Or maybe I could hurt my husband. Or maybe I don't want to be in this relationship, actually, even though he's wonderful. But what if I'm not worthy? Or what if I one day discover that he's a sham and he's been doing things behind my back? Or what if one day I wake up and I'm attracted to people of the same gender instead of my husband? And wouldn't that then be awful or horrible? But you'll notice that every one of those questions started with 2 words. And did everyone catch what those 2 words are? They are what if, followed by the worst case scenario that you could possibly come up with. Now, I'll tell you, if you want to get a great glimpse, a really great glimpse on what OCD is? It's what if, followed by all of the worst case scenarios that you could possibly come up with. So, yeah, themes change, right? Maybe you get treatment for one, and then OCD says, all right, well, shoot, I can't work on that one anymore. Ha, I'll try this one. Now, here's the goal of you as a good patient: to apply all of the skills that you learn to challenge one type of OCD to whatever other type of OCD might pop up. Right? That's really what your job is as a patient, is to do that very thing. Because you see, we don't really want to do therapy for a type of OCD. We want to do therapy for OCD and to apply that type of therapy to all of the types of OCD. And that's where exposure and response prevention comes in. You can apply ERP to any type of obsessive compulsive disorder. Right? And that's what I want all of you to think about. The ERP that you have learned applies to all the types of OCD. And everybody remember, OCD is incredibly predictable. Okay? OCD will search out and find what's really important to you and cause you to doubt it. OCD will throw worst case scenarios at you. OCD will activate your fight, flight, or freeze response and get you to believe things like back there. It feels so real, though. OCD is amazingly predictable. And if it's predictable, guess what? Easily challenged. Use its predictability against it, because then you could really challenge it. Alexis asks about OCD and addiction. Are they related? Well, they can very much be, Alexis. In fact, yours truly right here was the first person to open a residential treatment center at the Foglia Family Foundation Residential Treatment Center, part of Amita Health in Elk Grove Village, Illinois. The Foglia Family Foundation Residential Treatment Center was the first treatment center to treat OCD and addiction in the same place. Because currently, if you try to go to any of the other residentials and you have an addiction, they're going to say, nope, don't want you. Don't treat that here. Got to go get that addiction treated first. But soon I'm going to have on a friend of mine, Margaret Sisson, who is the president of Riley's Wish Foundation. Margaret was the mother of Riley. And Riley died of an overdose. And Riley had OCD and substance use disorder. And Riley got kicked out of an OCD treatment center for trying to score meds. I kicked him out. And when Margaret founded Riley's Wish, she had a goal, which was, we got to bring awareness to the fact that people who have OCD also, up to 25% of them, have some substance use issues. And so with that, we opened our center and we took people in who had both, and we helped them. And we showed that it could be done. So people may turn to substance use because they have OCD and they have these intrusive thoughts or images or urges that they don't like. So they turn to substances as a way to deal with them, so that it kind of drowns them out, right? You could also see a relationship that people might use more than they would want to because they have to use perfectly. And so maybe they do a certain snort of something or a shot of something, but it didn't feel just right. So they have to do it again until it feels just right. That could lead to even overdosing for people as well. So yeah, there can be some relationships. Eric says, Dr. McGrath, you are the most intelligent OCD doctor known to man. Ooh, oh man, Saltmaster, I think you were trumped there. Oh, another debate reference there, everyone. Last night. See, I hope you got that. Yeah. Not so bad there. Arrow, you're winning. Julia talks about meditation. And yes, I think, I'm sorry. Rennick says that. My apologies. You were talking to Julia. Yes, mindfulness can definitely help. John Hirschfield and Shala Nicely wrote a really nice book about mindfulness and OCD. So I think that you can never do too much of that kind of stuff. Just remember, don't do it in the midst of doing ERP. Do it separately from that. Now, here's a fascinating question. Would I like to have OCD for a whole day? Do you think that it would be beneficial for you in your work? I'm studying cognitive neuroscience, hoping I can work with OCD in the future. Wow. I never thought of that question. Would I like to? From how everyone describes it, I probably would not like to at all, right? I don't think that I would like to. Would it probably help me understand it even better than I do? It could very well, right? So that would be kind of I'd be interested in it more from the scientific investigation aspect, but I don't think I would like to have it. Right. Just because again, everybody who's ever talked to me about it says you don't want OCD. Right. And they get mad when people say, well, I have a little OCD because it trivializes OCD. Or I've even written a blog about stop saying in the news, well, in the COVID world, maybe we should all have a little OCD now. No, we shouldn't. No, that's not a great idea. But wow, thanks for that question. I'm really going to think about that. I really like that. You know where you can get help for OCD, though, through the NoCD app, everybody. Treatmyocd.com. Why don't you go there? Go to that link below me. That's where Miss Kaylee says it is. Hi, Kaylee, behind the scenes, Kaylee. Well, that's your new nickname, behind the scenes, Kaylee. And we're going to be in all 50 states by the end of the year. We take more and more insurances for our teletherapy. So please join us, everybody. The Dankert, or Dankert. I've been really struggling with contamination OCD since the whole COVID-19 thing. Is there any way of practicing better willpower? I good at recognizing triggers, but lack willpower. Well, I think you take a look then at a reward and a consequence program. And you reward yourself for challenging your OCD, but then there is a consequence for giving in to what your OCD wants you to do. One thing that I have done recently for that is I have set up with patients that if you do a certain behavior that you don't want to do, right, more than so many times a day, and we might see that number lower over the course of days. If you go over that, every time you go over that, you have to put a quarter in the jar. And at the end of the week, you will take all those quarters and you will mail those quarters to the opposite political party fundraising campaign. So I've had people actually mail off money to the opposite campaign that they are voting for as a consequence of doing their OCD behaviors. So I think that that's what comes in. What are your rewards for challenging your OCD? What are your consequences for giving into your OCD? Don't just rely on willpower. Put some external things. Willpower would be this internal thing. You might need some external motivators there as well, too. So I hope that that helps. Heather says her OCD changed during her pregnancy. It was cheating OCD, and now it's orientation OCD. Will it change after she has her baby, or how can she change your theme on purpose? This is the worst. Well, boy, on purpose. That is a first. I haven't been asked that question. Thank you. We're getting some great questions tonight. This is really fun. I've not seen anybody be able to change it on purpose. And will it change after you have your baby? I have no idea. It may not. So there's no way. And of course you say it's the worst, but I bet cheating was the worst until orientation came. And if it switches to something else, then that will be the worst. And then you'll wish it was orientation based. So I see this a lot. And in fact, I've said this before, but one of my very favorite things that I've ever done is when I'm doing a group, and this was back when we were doing live things in our partial program at Alexian Brothers Behavioral Health Hospital. I'd bring a new person into the room and I'd say, okay, have a seat. This is our OCD group. Here we talk about OCD. People would introduce themselves, and I'm so-and-so, and I have this, and let me tell you a little bit about my OCD. And I'd always see the new person kind of go to the person next to them and say, I wish I had that kind of OCD, because that would be really easy to deal with. And I'd always stop the group and say, okay, he did what every one of you had already done. What did you all do? Then they all say, oh, I wish I had that type of OCD instead of the type I have. Yeah, because everybody thinks any other kind of OCD would be better than the kind of OCD they have. Standard, natural, 100%. You all think that. It is the way that it is. Why do you think that? Because you think at this point in time, the kind that you have is the worst ever and it sucks. So you're going to think that until the new one comes, and then that's going to be even worse to you. Right? It's just the way that it goes. If a new one comes, that is too. Why does this OCD feel so real? My other ones felt real, but this one feels realer. Yeah, well, again, it feels realer. That's what we were just talking about, right? It wants to one up itself all the time. Oh, you think that was bad? Wait till this one shows up. Right? So, yes, toy. I'm so glad you said that. Grr, gets me so mad when docs call this GAD. Yeah, you know, there's a lot of people misdiagnosed with generalized anxiety disorder when 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 it really is obsessive compulsive disorder, and that just kind of goes to show, for unfortunately many people, their lack of knowledge about obsessive compulsive disorder. So we're here to educate therapists and bring them on as teletherapists so that we provide evidence-based treatment with trained therapists to people across the country, and people don't have to get misdiagnosed anymore. Like our founder, Stephen Smith, had that happen to him. So Susan talks about the bug again. If I drove, that would be me. And then she says, "Oh my God, doctor, the thought of holding an insect might put me in the rubber room." Well, Susan, I would bet you, Susan, I could get you holding an insect within about an hour. I would put money on that, Susan, that I could do that because I've done it with people before. So, in my opinion, Amy asks, can someone with severe OCD get better with ERP if they've had it for 30 plus years? Amy, my oldest patient was in their 80s, late 80s. He had OCD for 70 years and he got better by doing a couple of weeks in an intensive program and then doing individual therapy after that for obsessive compulsive disorder. So, Amy, I know someone who had OCD 40 years longer than you've had it. And I did great work with them and they got a lot better. So, yes, it is possible. Question. Why don't we take everyone's insurance? Well, very simple. It's amazingly difficult to get on insurance panels, just so you know. And so we are constantly working on getting on insurance panels. But I'll tell you what, it's not the easiest thing to do. So we have a team that's their job is to get more insurance coverage, just so you know. So I hope that all of you can kind of recognize that. And Carl jumped in on that one as well too. Yeah. If we could just accept people's insurances right now, we would. But it wouldn't mean that you'd get paid. We could say, "Oh yeah, we'll take your insurance." But if we don't have an agreement with your insurance company, which believe me, we reach out constantly to all sorts of them, it's up to them to do agreements back with us as well too. So it is pretty darn complex, just so you know. So Hadisha says an hour. She did ERP for months and it didn't work. Give me an hour. I'll have you and Susan holding a bug. I promise you. I could do it. I could do it. Get a big old cicada. Hold it right in our hands. Pretty fun. I went to a pet store with someone one time who had massive bug phobia, and we held a tarantula within 20 minutes. So I've seen it work. I know that it can work. How come my obsessions come out when people talk about OCD, like what's going on right now? Yeah. It's kind of like how come my tinnitus gets worse when I talk about my tinnitus, right? Uh, I call it the new car effect. If you've ever bought a new car, you never saw anybody driving it until you drive off the lot. And then suddenly everybody's driving that car because you just notice that car constantly everywhere all over the place. It's the same kind of thing, right? When you're hearing it, it brings it to the forefront. And when it's brought to the forefront, it can trigger things. Now, in many ways, that's why we want to do the therapy for OCD. We want to bring it to the forefront. We want to trigger things. We want to teach you how to handle it so that when it is brought to the forefront in the future, you won't care so much because you've already worked on it. So that should be pretty great. So Carl lost tonight, just so you know, about being the cool person, because he says, what's the best band in the world and why is it not Rush? Carl, you lose, just so you know. Gibgob, help. When I say to myself, I'm not supposed to give in to the compulsions, that in and of itself feels like I cheated because I ruminated over the solution to OCD, then I kept ruminating about this. Well, how about this? Do you have to say to yourself that you're not supposed to give in to the compulsions? Or can you just live with the fact that you didn't get into them, right? I mean, that might be something to kind of think about. Let me pop up. There's more questions coming, so that moves. Saying to yourself, I'm going to pop it over here. Saying to yourself that you're not supposed to give in to the compulsions could actually become a compulsion, right? Because you think, now I have to tell myself not to give into the compulsion. Could you not give into the compulsion without telling yourself not to give into the compulsion? That might be something to consider, right? I would bet that you would be able to not give into the compulsion without telling yourself to not give into the compulsion. So you might think about that. Let's see. Madisuz asks, can I answer your question? I'm sorry if I missed it, and I don't really know where it is because there's like 1,000 statements or questions here. So maybe if you could just type it again for me, that would be helpful. How do you combat existential OCD when it's focused on whether reality is real or not? We know there's no real answer to that, so it feels scary. Well, if you know that there's no real answer to that, what is scary about it? I'll say this. I'm not scared of it. I might be living in the Matrix right now, not so scared about it. So is it actually scary? Or do you have a disorder that tells you until you have an absolute 100% answer, you should be afraid of it? And I think that's probably what's actually going on right now, is that you're being hooked into the idea that because you have a disorder called the doubting disorder, but which demands that you get a 100% answer for something, how can you then actually be okay with something without having a 100% answer about it, even though you have a disorder that doesn't allow for that? See, there's kind of circular reasoning logic into that whole experience. So do you have to combat existential OCD? Or can you just accept the fact that this may or may not be real? Don't really know. And frankly, don't really have to care. I'm just going to go on, live my life and see what happens. If it really even is my life, who knows? But I'm going to go live it anyway. All right. Our last question. Something happens when I begin a relationship. I start to feel like I need certainty about how other person feels. It's actually pretty painful. Yep. Well, we're never going to get certainty to know how somebody else totally feels about us, because they feel the way they feel about us and we can't feel their emotions the way they feel them. We can get an idea, an approximation, but there's no way of truly knowing any way that anybody else feels about anything. So we might have to just live with the fact that we don't know. All right. Well, Matuz keeps asking me to answer his question, but doesn't write his question or her question back. I'm sorry. I'm not familiar with that name. So Susan says, what if Rod Serling came after you, doctor? Well, it could be spooky, but I'd still hold the bug. Just so you know. Everyone, it's been a slice. Come back next week. Wednesday nights are so helpful. Thank you, Toy. Appreciate it. Looking forward to talking to all of you next week. May have a guest on. Someone to help me answer some questions. Always a good time. Remember, treatmyocd.com. Download the NoCD app. We'll talk to you soon. Good night, everybody.